Vinaka, everyone. I hope you can all hear me. A warm civil welcome to all of you who have joined us online this afternoon from across the region and beyond for this webinar titled Optimism in the Face of Overwhelming Odds, the Resilience of Our Pacific Women, Children and Persons with Disabilities. On behalf of the Pacific Islands Forum Secretariat and the Pacific Resilience Partnership, the host of this webinar, Navalevu, big thank you for joining us. My name is Miles Young. I'm honored to be moderating this webinar, which is part of a series hosted by PIFS and the Pacific Resilience Partnership. The webinars are designed to share information and best practices on resilient development approaches to climate change and disasters that align with the underlying intent of the Framework for Resilient Development in the Pacific, the FRDP, as well as with other regional frameworks such as the Pacific Regional Partnership, the Pacific Leaders Gender Equality Declaration, and the Pacific Framework on the Rights of Persons with Disabilities. And to date, there have been, as I understand it, 6 webinars as part of this series. And for those who may have missed them, I'd encourage you to have a look at the Pacific Resilience Partnership website and to listen to these previous webinars. They're very, very interesting, very informative. For this particular webinar, we'll consider the experiences of women, children, and persons with disabilities, including other at-risk groups, such as senior citizens, and we'll have the privilege of speaking with 4 distinguished speakers, whom I'll introduce in a minute. But before then, if I could just quickly provide some context. As we all know, climate change and disaster risks increase the vulnerability of Pacific Island people and significantly undermines the sustainable development of the region. Although the level of exposure is similar across Pacific Island countries and territories, vulnerability differs, and countries and territories have specific environmental, social, and economic challenges that result in limited capacity to reduce vulnerability. Gender, age, and disability are factors that can further compound the risks that communities face in relation to climate change and disaster, which, as we have all experienced over the last 12 months or so, are further intensified by COVID-19. The research indicates that in times of disaster, women and children are 14 times more likely to die than men, and persons with disabilities are 2 to 4 times more likely to be injured or die. So I just wanted to repeat that, because those findings are really important to hear. Women and children in times of disaster are 14 times more likely to die than men, and persons with disabilities are 2 to 4 times more likely to be injured or to die. Elderly people with physical or cognitive disabilities are among the population subgroups that are vulnerable or disadvantaged during periods of crisis and social disorganization caused by disasters, and in the weeks, months, and years following such events. So climate change and disasters selectively impact lives and livelihoods, and often disproportionately affect those least able to cope. The Framework for Resilient Development in the Pacific advocates for a systematic adoption of an inclusive and participatory approach to measures in response to climate change and disasters, which are not just effective and equitable, but also equitable in meeting the needs of all members of the community. In other words, leaving no one behind. Human rights-based approaches have been incorporated into the FRDP, and the FRDP also recognizes the critical and important role of integrating gender considerations, and it advocates for equitable participation of men and women in planning and implementation of resilience building activities. So with that introduction to the context, I'd like to introduce our speakers, and we have 4 very distinguished speakers who have very interesting and innovative viewpoints to share with us. Nolene Nambulivo is an activist and spokesperson on climate change, sustainable development, and gender equality. She is the co-founder and political advisor for Diverse Voices and Action for Equality, better known as DIVA, an organization focusing on climate justice, violence against women, human rights, and LGBTQ rights. So welcome, welcome Nolene. Our second speaker is Joshko Wakmiasi, who is the Executive Director of the Spinal Injury Association of Fiji. Apart from his work with the Spinal Injury Association, Joshko is active in the wider disability sector. He's on the steering committee of the United Nations Volunteers. He's also a council member of the Fiji National Council of Disabled Persons and a board member of Fiji Council of Social Services. He's also a working group member of the Sustainable Goals Development Fund. Again, Nak for your time, Joshko, and welcome. Our third speaker is Nunia Vuvukula, who represents the International Federation of Red Cross, and her area of work includes providing technical assistance on protection, gender, and inclusion to 11 Pacific Red Cross national societies. And our final speaker will be Emile Latu, who joins us from Tonga. Emile is the Capacity Development Officer with the Civil Society Forum of Tonga, and her work includes humanitarian responses, and she will be sharing stories from disabled people's organizations in Tonga. So big welcome, big nabaleva to our speakers. After we hear from each speaker, there will be an opportunity for questions and comments, which, as I understand it, can only be posed through the chat box. So please, if you have any questions or comments, if you could write them into the chat box, and they will be moderated through that. So Vinak, I've said a lot, so without further ado, let me start by inviting Nolene. And perhaps, Nolene, I can start by posing your question. So women are disproportionately affected by the effects of climate change and increasing frequency and severity of natural disasters. And I made the earlier comment about, in times of disaster, women and children are 14 times more likely to die than men. Can I just get your reflections on that finding, and then maybe your thoughts on some innovative approaches or solutions that have supported women's preparedness and resilience? Thank you, Nolene.
Thanks very much, and thanks for the opportunity. I actually really love the framing of this session, because it's about the recognizing that women and girls and LGBTQI people and people with disabilities and others are always in the center of this work. And we are obviously, as you raised in your original statement, Miles, we're in the middle of it because we are the ones who often are both the ones who are most deeply affected, but also because we have the knowledge on the ground, and because the kinds of multiple intelligence, the multiple kinds of knowledge and understanding that comes from different people in community is the way that we are going to be able to truly say, that we are resilient and that we are finding strategies that work to keep ourselves safe, and to change the society that we're in, to change the economics of this planet that really cause some of these problems of ecological and climate damage. So that's really the first things to say. And then to the specific question around, so what are women doing? There's many. This was, I think, the easiest thing for me to just write a whole list of the amazing work that people have been doing on this area. And the first thing I'd say is, so Viva for Equality, just to give a quick kind of overview, is that we're an organization now 10 years old, and we're a network that tries to kind of do the work from local to global, and that's not easy, and to do it consistently in many, many kinds of areas, because we all know that the change that we require is not in one particular area. We're working with all kinds of groups, and that takes particular kinds of skills and experience to get that praxis, so that we can do the work with all kinds of stakeholders. And the second thing I'd say about us is that we try and make sure that we're linking social, economic, ecological, and climate justice. And that means that we have to think more deeply about the concepts that we're using and the ways of seeing the world. So it means we have to work on sexual orientation and gender identity and expression and sex characteristics, which we sometimes call SOGISEC. It means we have to work on sexual and reproductive health and rights. We're part of the National Action Plan to Prevent Violence Against Women and Girls, with many others right now. So the work on EVOG, but also things about debt and financialization and bad business practices, bad economics, and maldevelopment. So the issues around economic justice, and then obviously climate and ecological justice. And sometimes it's a misnomer to just say, we're working on climate justice. The deeper story is that our Earth and its, and its systems and the species on the planet, including humans, are in deep trouble. And so that means that work is extraordinarily linked, whether it's about the 70% of rainforests that are gone now, the coral reefs, 150 to 200 species a day going extinct. So all of these issues, the first thing to say is that women and girls, I think, have been trying, and particularly feminist movements and social progressive movements have been trying to think about this from a more earth-based perspective, to say we have to look at it from an ecosphere perspective. Okay, and then you go from the global to the local to say that's also about the bodies of those who are carrying this work. So if we know that across the Pacific we have double the levels of violence against women and girls, then you're working in a context where you have to take that into consideration while you're doing all of this work on resilient communities. It is a work of resilience to work on the violence question, and to look at issues of patriarchy and homophobia and transphobia. All of those things are about how society functions and how we're going to make these societies better places that are more resilient for everyone, because we can't talk about it in the mainstream. And so we have to do two sets of work that we've been trying to frame it as: you have to do the work of breaking and you have to do the work of building. Sometimes it feels, a little easier to name what's going wrong, but the building of something new, the development alternatives that are required are also just as important. And then the last point I'll make before I point out some of the actual examples is we also have to be less worried about whether we're palatable, whether our, the way we speak is in a way that is acceptable to people, because we have to be strong, we have to be accurate, and we have to work from the facts. And if it's inconvenient for some to hear it in a certain way, well, that is our job as civil society, to be able to take these ideas forward and to work through the praxis of new kinds of being in the world. So resilience is about pushing back on poor policy and maldevelopment as much as it's building good ones. So, building all those different heterodox kinds of solutions and all kinds of different futures that we're looking to in the world. And we can do that. We already are, as women in Fiji and Pacific. So there are women who are working on mitigation, and they're part of things like 350 Pacific, and they're holding strong against the fossil fuel industries, and they're working on issues of debt and aid and trade and all of those issues that are also about resilient communities. And there are others who are working on financing for development, or they're working on the multilateral system, and they're truly trying to see how what is being done at the global has a direct impact on those of us in the Pacific. And then those of us who, for instance, I'm in Nandi at the moment, and we're working on SOGISEC and human rights, and we're doing it with all of the staff across FNU. And that's an important set of resilience work, because when young people, whether LGBTQI or others or women, move through the world, are they in sectors of society where they can feel like they can be heard and where their views are taken into account? So some of our work is about changing norms, norm setting, and working with all of the institutions, whether it's police, whether it's corrective services, whether it's education and health, to try and change some of those systems that can oppress people. There is a work of young grassroots women called Ganga Network that is already using some online organizing, very quiet, closed online hubs where they're working on, okay, what is our role? And if we don't fit into the mainstream organizing networks, what are some other ways that we can organize? So those beautiful little sets of practice that are everywhere, sometimes not seen, you know, in the public eye, but they're happening. Our hubs, we have 8 hubs that are around the country that are self-organized hubs by LBT women, lesbian, bisexual, and trans masculine women and people. And so those, where they need to be underground, they are underground. If there's a lot of violence from male community and others, then they will be underground. Otherwise, we are seen on the streets in many things. Women's Assembly for International Women's Day in La Toca in Shirley Park on Saturday, if people are around there. So sometimes the work is public and sometimes it is below ground because it has to be. Those of us who are doing the work around COVID and economic justice. For instance, we last year did 12 waves of mutual aid assistance, working across women in Suva, in urban areas, with women in rural areas, in Kandavu and in Gamea and Ngao and many other places, to kind of say, what are our needs? What are we able to do together? And when the state is in a state, when there's a lot for it to deal with, what are the resiliences that we already have? So for instance, there were ways that we didn't have to move into the communities, but we were able to send packets of basic food items, but also to be able to send SRHR supplies, medical supplies. We supply the Nasinikoro stations in many of the rural and remote villages and settlements around the country. And that kind of frontline support for each other as women, sometimes it's just safety equipment, you know, PPE equipment, or things that, that women need at various points, whether it's because they're dealing with a cyclone or whether it's because they're dealing with a pandemic. The sets of trust and relationships that are built up over time are those things that mean we don't have to make a giant pivot every time a disaster hits, because those development of those relationships have already taken place. And we have telephone trees that we use all the time to be in touch with each other and to make sure that, you know, that we know where the pockets of poverty are, that we know where there are older women, for instance, in informal settlements who may not have access to, you know, their bathroom or toilet might have been blown down. So what are the ways that our women builders networks, for instance, are able to very quickly move and get to them and support them in small ways, and sometimes in larger ways. So for instance, DIVA is also doing a lot of work around social floor, social protection, and also hard protection, what they call, you know, kind of the areas like transport and bridges and roads. So we've just come back from Kandavu about 2 weeks ago, where a bridge was built that people have been waiting to be built since before Cyclone Winston. And so working together by the local community with the provincial administrator's office and the women builders from Diva for Equality and the village itself, they were able to finally move from, you know, 2 coconut tree logs that are across a river, and 2 children had nearly drowned from walking across those things. It's the only way to get to the school in that community, and that we were able to build that over a course of 2 weeks. And the part of the gender transformative element of that is that there were negotiations going on all the time around, can there be young women who are involved in the building of the bridge? If so, what are the issues around wearing shorts or not wearing shorts within a, you know, local environment, within a village environment? And those negotiations were able to happen because we were doing some set of resilience work together, but then we were also able to push some of those boundaries and make the claims for gender just ways to be in the world, for young women to be involved in those. And over time, through building those sets of work in different places, they become cases where you can show that change is possible. Because one of the hardest things is when communities say, okay, this is a cultural practice and it will never change. we know as humans that every system there is flexibility and ways to negotiate that are built into all of our societies. And for us, it's the ability for women and for girls and for LGBTQI people and men and boys to be able to negotiate in ways that are about justice and human rights, knowing where the red lines are and knowing what is beloved community, what are the ways that we want to work with each other in different ways. And that's happening across the Pacific right now. So we have these women builders that have been trained by Habitat for Humanity and APTC and with DIVA, filling in those gaps that are about the gender gaps, you know, whether it's young women who aren't able to have enough money to be able to go and do their training because they have to also provide for childcare and support. So we were able to give some unconditional cash transfers to them every fortnight for them to be able, you know, to be in those classes for 6 months. And that's meant that all of them got through that course, and that we now have a group of women who are not just builders and who are not just going out and, you know, and changing the construction industry, which takes time, but that they're able to also contribute in really amazing concrete material ways, repairing bathrooms and toilets on their, you know, building outdoor veranda areas so that the smoke doesn't come into a home for a young woman, LBT woman who has medical conditions, building rails, paths to toilets, wheelchair access, renovating houses that have been ruined by loss and damage. So insisting that we are part of the solution, and that if we are listened to and if we are able to co-create those strategies, that's the way that we can come up with new and innovative ways, because nobody can do it on their own, including the state and including the mainstream, you know, kind of development infrastructure. The reality is that we require all kinds of knowledge and experience in order to do this work. And in the end, what we find is that the material response is the structural change. It's part of the structural change. We can't separate it. And the idea that we can is, I think, being blown out of the water, both by COVID, by the ways that, you know, frontline workers were part of the response effort, but also that women have always been part of the solution. If you look at the issue of care and unpaid care and domestic labor, and the ways that women and girls are the infrastructure of communities and society, but then we don't recognize it, we don't reduce the burden. We know from some of these studies that DIVA is working with on with Oxfam in the Pacific and others, is that there are so many women who are just absolutely exhausted. And as the levels of unpaid care, domestic and communal work, Songo work, as that all increases, that's all laying on the bodies of women. And then we want to say to them, oh, but we don't want to talk about universal basic income. We don't want to talk about social pension plans. We don't want to talk about the feminization of poverty, you know, in women's old age. Well, they've been carrying the work of development, including what we call resilient development, throughout their whole life course, throughout their whole life cycle. Society is built on this. So we have to be listening much more. And we think at DIVA, having a real kind of equity pact with women and girls and saying, we see you and the work we do, and we have to reconfigure our laws and our societies and our practice in order to show that you are, you know, you are a huge part of this work. So last year, DIVA organized and worked with five schools in the most at-risk and high-need areas in Central Division, because one of the quick things that we found out was it was clear that a lot of children weren't going back to school after the lockdown. We know that was like 35,000 children, according to the Department of Welfare, but we think it's probably more. So 2 teams of long-time unemployed women and gender non-binary people made up these catering teams, and over the course of 5 months, for those first initial crucial months, what they did was just prepare and take school meals to these 5 high-need schools, and that was 26,000 meals over 5 months, and it's an extraordinary effort. And the gender piece of that, I just wanted to say, Miles, I'll close in a second, but just to say that part of that is not just about the provision of meals, but the gender element is, for instance, it's the decent work and being able to have some, some income for long-term unemployed women, but also, so volunteerism is a very middle-class kind of idea. And it's an idea that doesn't work for anyone who's already in poverty, because you have to then fork out to do the work of volunteerism. So if there are ways that we can build justice and equality into these programs, then, and doing things like making sure that a reference comes out of the end of the project so that it becomes part of someone's CV, that it might be the first time they've ever had a formal reference for paid work in their lives, and that matters, and that is part of resilience, is you're building more capacity for people to be able to truly be part of community and society. So I think that's what I'll end in, is women are always resilient, and we're asked to do these sets of work in the most complex, fierce times, and we are doing it. But now what we have to do is require of ourselves and of communities and CSOs and states and multilateral and development programming to see that and to do something about it and to reflect us. And that's why I like this session, is put the money and put the energy and put the resources where the risk is, but also where the real resilient community work is. Thanks a lot. Thank you.
Thank you very much, Nolene. I mean, to be honest, I could sit here and listen to you all day long. Such an interesting and innovative ideas, and also very passionate. And what I really appreciated about what you've just said is that what is the deeper story? What are the structural changes that need to be addressed? And as we all know, and as you've clearly articulated, you need a multi-dimensional approach to address these sorts of structural issues, and not working in silos. You need multi-sectoral approaches, multi-dimensional approaches that complement and are mutually reinforcing of each other. So, so thank you for that presentation. If members of the audience wish to start putting in questions into the chat box, please feel free, because we have a moderator who will be monitoring that and sending those questions through to me. So thank you, Nolene. Please don't go, because we will have opportunity later to bring you to some of those questions that are asked. So our second speaker is Joshko, and as I mentioned earlier, research has indicated that persons with disabilities are 2 to 4 times more likely to be injured or die in times of disaster. So similar to Nolene, Joshua, can I ask you for your own reflections on this finding, and also whether awareness of the issues and needs of persons with disabilities during disasters has actually increased in recent years? What factors have contributed to this? And perhaps most importantly, whether increased awareness has actually resulted in more effective responses. Thank you, Joshua.
Thank you, Miles. First of all, I'd like to start off by saying, disaster is everybody's fault. It impacts everybody. Resilience is how well is one prepared in terms of disaster and what's going to happen. I think research has also identified is that we're expecting more and more catastrophic cyclones. I think the recent experience of Yasa and Ana is a good example, is because while Yasa was a Category 5 cyclone, Ana was a Category 1 only a few weeks after that. But within Cyclone Ana, one could realize that for the first time, we've been asking this internally within our own sector, is that when has in Fiji's history has the major rivers burst its banks? One is that nobody can ever recall our major rivers bursting its banks, not all at once during a cyclone. And considering the Category 1 cyclone, the question then obviously is that is a 1 similar to a 5 when it comes to disaster. And this only then further impacted as far as with COVID that has been around ever since now, almost a year in Fiji. Going to what you mentioned, or the question that you have, as in terms of, okay, where are we in terms of awareness? The awareness programs by organizations for persons with disability, it's something that's been going for quite a long time. And I guess, I'm thankful that Nolan, went first in terms of gender, is because we learned and we used the gender vehicle, the gender processes, to try and ensure that persons with disability also are heard. So if you go back 50 years ago, a lot of issues that we have nowadays in terms of disability visibility was more of a gender, was more what gender was trying to make visible, make awareness for back then. Opportunities for employment, 50 years ago, one would see that women who are very professional, who outright had the capacity to actually carry out the work, getting into managerial levels would be a big challenge. Now it's not become a gender issue, but more an able-disabled issue, employment opportunities. So resilience is only as good as a person who's able to prepare before any disaster. How well prepared are they? And this costs money. And this is where often where the disparities are, the cost of disability. When you look at disaster in its phases in terms of preparedness, it's how well prepared, what is available for you. The state often comes in post-disaster for areas that have been impacted. So the preparation of individuals often is left up to them. And this is where persons with disability often have the challenge. And this is where the risk factor is in terms of the question of the research, on how much more vulnerable are persons with disability in times of disaster. The question is that when they're also in times of disaster, is that evacuation centers, often people are evacuated to evacuation centers and I think places are set up. Do they take into consideration disability-related issues in these evacuation centers? One is that when they open up, when should they be open for persons with disability to start moving from their homes? And how well versed? So most persons with disability get to see this environment that is set up as evacuation centers only in times of disaster. So as able-bodied people, for those that are watching, the question I will ask is that, how would you feel if somebody came up to you and said, I need to take you for your own safety to another location, but you've never been there. You've never realized, and the thing is that often, because you've never been there, the biggest question would be, because in the first place it was never accessible. That's why you could not go there. So, you're putting yourself in harm's way. So often the insecurity by persons with disability to these environments. That is only exacerbated further, especially if you're a woman with disability. Because if you're a woman with disability, then you're asking questions like privacy. I think I look at women with disability who then need medical consumables. One, because these can cause embarrassing factors in these environments. So these are some of the challenges when it comes to ensuring that women and girls with disability actually can go to these places comfortably. And it applies to all, because even males with disability, some of them also even use these medical consumables. And I'm not talking about the mere fact of when people talk about medical consumables, the common thought is diapers. No, some of them use other forms of medical consumables. And some of these, they use indwelling catheters. And they need that private space. For those with psychosocial disability, one, the stigma that's already associated with psychosocial disability, forget about disaster in itself has a big stigma. In terms of this disaster, one, we wouldn't know how the person is then feeling. Anxiety, is there a safe space within these evacuation centers? Is there a safe environment whereby they can go and sit down? Because one, a lot of them don't do well in large crowds. The large crowd setting in itself, and with all of the excitement, that's what people like to call it, with all the anxiety that people go through in terms of disaster and all the, the insecurities, it only can add to their current situation. For many persons with disability, resilience, when we talk about resilience, is that it's only with what they are capable or what they're aware of, what they can afford. one of the biggest resilient factors that we have in order to safeguard people's lives is that they actually move not to the evacuation center, but to other homes, other relatives of theirs. But then they become a burden to these families. One that we've identified over this that we've been lobbying for most recently is the support system. So if a person with disability is not evacuated to an evacuation center, but yet goes and stay with another member of the community or goes and stay with relatives, then to ensure that the support system, whether it be for food rations, post-cyclone, to ensure that it is then given also to these individuals that could not go to these evacuation centers because they were not accessible in the first place. Then you got to look at things like when you talk about resilience in the face of disaster, is that if I have to go to an evacuation center, if a vehicle that comes and pick me up, is the vehicle accessible to also take my product? Or they're going to lift me into the vehicle and my wheelchair is at home and I'm crawling around the evacuation center because it does not have the products that I have. Now, where we come in as disabled persons organization, sitting, consulting with decision makers, whether it be NDMO or whether it be first responders, is making a strong case prior to cyclones, making a strong commitment and getting to inform that, for us to be just the beneficiaries of the service might not be suited for us. It's our lived experience in itself that can improve systems and structure. That way, we become more resilient in what we do and the approach. And also, it'll make recovery so much better and so much more easier and more cost effective. One of the examples that we could give is that one time we do consultations is that we can, okay, what is available within the centers? What needs to be there? What is the proximity? How soon can we start evacuating persons with disability to these areas? And when time post-disaster, how safe is it when they're going to go back home? Because you must remember is that after a disaster, for most persons with disability, especially if it's an access issue, for people like me who use an assistive device, as a wheelchair, is that any landslide, my whole landscape has changed. The whole process has changed. So how do we then ensure there's continuity to these areas? So the examples of the way forward, the partnerships that we've built, and in recent times, and the visibility of the awareness, is it working? Yes, very much so. It's because one, people getting to realize that how only they've experienced the examples that we can come up with and how to best inform, speak to other persons with disability, to encourage them to become part of the way the world is moving, or the way nationally, the way we are setting and taking steps towards ensuring that there's inclusiveness to what we do. We're starting to see results also from that. One area that we've always had a challenge in, and then things are now picking up better, is that we've set up our own emergency operations center every time there's a disaster. So that way we're getting well beforehand in terms of information. We also then are encouraging people to ensure that persons with disability on the ground work with communities from national level right down to district level, on who's where, what their needs might be. And this is in all phases or all forms of disaster. When we look at COVID, we're so thankful that persons with disability, when COVID only first came up, we started saying, please, it's prevention that is better than cure, restriction of movement, making sure that they isolate themselves, not put themselves in danger. So if they don't have to go out, not to go out. Because one thing that we realize is that if somebody with disability had acquired COVID, the venue for where they had to stay, the hospitalization of the individual, the challenge for people like me with different 24-hour carer, how do we do social distancing? It doesn't work for us. We can't live in isolation. This is in all forms of disaster in terms of support systems that's needed. One of the biggest gaps that we've identified is support systems that's needed by persons with disability. And I must end by saying this: whatever you do for persons with disability, you're not taking away from other members of society. But whatever you do without taking consideration and an engagement and vulnerable persons with disability, you're already isolating, starting on paper. Thank you.
Thank you, Joshko, for your presentation. One of the points that came out of that for me is that while there has been an increase in awareness around issues and needs, there's still a long way to go. And you'll recall just prior to this webinar, you and I were talking about how even an organization like SBC, an organization I work for, disability access is still an issue, a basic issue for the organization. So even though, you know, as you say, awareness has increased, there's still a long way to go. And I really appreciate also your final comment, which is that support does not necessarily take away or does not take away from support to others in the community. So I think that's a really good message to end your presentation. As I said, we'll have an opportunity later to come back to you. So I would appreciate if you could continue to stay with us. Very quickly now, I'll move into our third speaker. Nunia, if I could bring you into the conversation. Again, can I ask for your personal reflections on the finding that, you know, as I mentioned earlier, women and children are 14 times more likely to die than men in times of disaster? And then perhaps hear your thoughts on whether the needs of children and youth are being met during disaster responses, or effectively met, I should say. And how do traditional social protection networks provide support for them, for children and for young people? Thank you, Nunia. Nunia, I think your microphone is on mute. Sorry, if you don't mind unmuting. Thank you.
Can you hear me?
Yes, I can. Thank you.
Thank you, Miles. Yes, well, you know, sometimes children and youth are misunderstood for their inquisitiveness, curiosity, passion, and enthusiasm. And these can be mistaken sometimes for stubbornness or wanting to be smart, or referred to as immaturity and plain stupidity. You know, and again, sorry for that. So just to address the questions that have been posed to us this afternoon, as evident in our previous colleagues' presentations, the success of our response and recovery rests on our pre-planning and preparedness. We at FRC, we undertake a strong legal advocacy around disaster law, youth, shelter, and protection, gender inclusion work for inclusivity in legal policy formulation, disaster and emergency law formulation, and all forms of disaster risk management implementation. Again, you know, children and youth play a crucial role in our Pacific communities. Emergencies, as earlier mentioned by the two colleagues, that you know, exhibit existing gender inequalities and the incidence of sexual and gender-based violence and violence against children. Someone's sex, gender identity, and other factors including age, disability, sexual orientation, health status, social status, ethnicity, faith, and nationality, or lack thereof, shape the extent to which people are vulnerable to, affected by, respond to, and recover from emergencies. These differences are also the source of strengths which must be recognized and incorporated into all emergency preparedness, prevention, response, reconstruction, and recovery efforts to build resilient societies. The pace of life and change is very fast today, but if we sometimes look past these prejudices prejudice and take time to listen and see through the thoughts our children and youth share, we can find that we can be inspired to be better parents, become open to new ideas and possibilities, and be better prepared to support and meet their needs in times of disasters and emergencies. During disasters and emergencies, everyone feels stressed. This stress can translate into violence, particularly domestic violence and violence within the family. Because the adults may be stressed, they might not be able to support their children to identify positive or good coping mechanisms to address such stress. Women with dependent children are also some of the most impacted. I say this to highlight the need for factoring adequate child abuse preventative measures during the disaster preparedness phase, and this should be kept in mind through the response and recovery phase. With that being noted, some of IFRC approaches in meeting the needs of children and youth I will discuss this afternoon, particularly in three broad categories. One would be through the protection, gender, inclusion, and disaster law approach. Secondly would be with our shelter approach, and lastly on our youth and children and youth approach. In terms of our first approach, child protection advocacy at all levels of programming and operational work, through our disaster law work, we encourage the formation of community DRM committees at the community level, and further encourage the inclusion of representatives for persons with disabilities, women and youth in their membership. Our Red Cross and Red Crescent Youth Network also provides capacity building support on youth and leadership, youth issues, counseling, and programming, which prepares them for participating more meaningfully in DM. In the DM fora, not only in the national societies, but in all DM fora. Protection, gender inclusion, again, is one of the key priorities in various IFRC strategic frameworks and plans. The newly developed IFRC PGI in Emergencies Toolkit supports the integration of protection, gender and inclusion minimum standards into the transition from response to recovery, with ready-to-go tools, which can be drawn on and adapted when needed by responders. There are two key approaches to the integration of PGI in emergencies and recovery, both of which are supported in this toolkit. First is the PGI mainstreaming in all sectors, which range from integrating protection, gender, and inclusion issues effectively into the emergency appeal of action, to ensuring that women and girls have access to safe menstrual and hygiene management during emergencies. Secondly is on specialized or standalone activities that aim to protect and include people such as child protection, sexual and gender-based violence, prevention and response, and anti-trafficking initiatives. Moving on to the second broad approach, which is the shelter approach, we have a toolkit, which is the All Under One Roof Handbook and Training Package. This is a booklet and a training package for disability inclusive shelter and settlements in emergencies, which is a key reference for shelter practitioners. During disasters and emergencies, persons living with disabilities, inclusive of youth and children, are often overlooked and experience discrimination and exclusion, despite the adoption of increasingly rights-based approach to humanitarian assistance. The overarching objective of this All Under One Roof booklet is to transform the way humanitarian organizations approach inclusion and accessibility in their shelter programs. A few of the ways that it tries to achieve this is by ensuring that there is inclusion in phases of disaster management, preparedness, mitigation, response, early recovery, and full recovery. Ensuring that there are technical guidance in use for shelter and settlement programs, especially for inclusion of persons with disabilities, and also promoting participation and equal opportunities. What does the question we may ask is, what does the all under one roof have to do with youth and children? Firstly, persons with disabilities also include youths and children, and quite a sizable proportion of first responders, in our case, to a disaster are youths, meaning our volunteers. So having them trained up and changing their mindset to one that is more inclusive would begin to overhaul the way in which emergency response are conducted, and would ensure that people, no matter who they are, would get a safe and dignified shelter. Lastly, on our last broad approach, which is on children and youth, in terms of working with the children and youth are, of course, a key priority area in the Red Cross work in the Pacific, in alignment with the Ifrc youth policy. Pacific Red Cross National Societies implements programs and activities that supports children, particularly through Red Cross in school programs, such as Red Cross clubs at the primary school level. A few national Red Cross societies in the region also run persons with disabilities schools, such as in the Solomons and also in Tonga, supporting children with disabilities to further their educational needs. As part of our volunteer recruitment process at national society level, child protection policy is part of our volunteers induction, and as part of the volunteers code of conduct. In the Pacific, majority of our volunteers are young people, and they are often the front line of our programs and services with national Red Cross societies, including as first responders during times of disasters, and are active volunteers in relevant programs, areas of health, blood donor recruitment, first aid, water and sanitation, climate change, and disaster risk reduction. Our approaches, toolkits, and checklists are based on the experiences of national societies all over the world, including the 14 national societies in the Pacific in disaster management, preparing, responding, and supporting recovery from disasters at community and also at national level through their auxiliary role to their respective governments. Our materials are regularly reviewed and updated to ensure that it integrates new emerging issues such as SARS and COVID-19. Henceforth, for us, it is a continuous process. Thank you.
Vinaka and Nunia for taking us through the work that IFRC does, again, demonstrating a multifaceted, multi-dimensional approach. I might, looking at the time, I might just go very quickly now to Emile. Emile, Vinaka, you've been listening patiently. I just wanted to bring you in here, and you work closely in your role with the Civil Society Forum of Tonga. You work closely with disabled people's organizations. I wonder if you could share with us some resilience stories from DPOs in Tonga to help inform resilience responses to climate change and disaster. Thank you, Emile.
Thank you, Miles, and good afternoon, everyone. Talking about the stories that have been collected in Tonga, in last November, we have assisted the disability and conducting a training of trainers for the people with disabilities, trying to find out the issues and the problems that they faced during the COVID-19. The team of facilitators were made up of the representative from the 3 disability organizations in Tonga, and they went out to the community and conducted the training. 120 disabilities and carers participated in this training. But the stories that have been gathered after the training, as I was about to share, there were a lot of stories, but I'll concentrate on 5 stories because they have, I think, different. Firstly, there was this visual impairment sharing her experience going to the bank, and the security stopped her outside the bank because of social distance. So the carer was allowed to go inside, and the disability was told to stand outside beside the public road. Yeah, there was a problem of anticipating that a vehicle might hit her on the road, or other problem might happen to her while she was standing outside the bank. The other story is that there was this impotent guy. He was only one hand, coming back from the plantation on his vehicle, and he was stopped by the police. And he said that he was only 8 minutes late coming from the plantation, but because of the curfew time, the police fined him, and he was even ended up in prison. But he also shared that while in prison, there was no safety, or he was saying that if there was a victim going inside the prison, that's the quickest way to spread the COVID-19, because there was no system in place for safety while inside the prison. The third story is about this disabled person. She was a patient within the hospital, but because of social distance, her carer was told to go home and leave this disability. She wasn't able to go. She was a wheelchair person, so she was told to stay alone, and the carer was chased outside. So her kind of double up because there was no one around, to rely on, and even the nurses and the doctors just come in and go, and she was alone. The fourth story is about this person, I'd say a dwarf, but her husband and her in-laws are, all of them are low vision. She shared a story that she was very sick during the curfew time, and they have a vehicle, but because of the curfew, the community police stopped her from going to the hospital. So she had until the 5 in the morning when the curfew time is open up for her to go to the hospital. Last but not the least is a sharing from experience during the boarding the ship, the ferries, to go to the outer islands. So apparently there's no kind of system in a wharf. So when everyone paid their ticket, once the boarding time is called out, everyone rushed in. So sometimes the passengers were stopped. It's like the passengers were overflowed. So some of them were stopped at the wharf, and apparently the disability
I think we might have a connectivity issue there with Emily in Tonga. We'll just see whether Emily is able to reconnect. But what really resonated to me with the stories that she shared was that these are just ordinary people going about their everyday lives, doing ordinary day-to-day things, and these are some of the things that people with persons with disabilities encounter on a daily basis. So it's really important that we continue to hear stories about the issues that they face, just going about their day-to-day lives, the things that they have to come across on a daily basis that that others may not encounter. So thank you, Emily. We had a connectivity issue there, and so I just jumped in to make a comment about your presentation. We're now right on 2, but I see that there is a question here from one of the participants. So maybe I'll ask that question if we've got some time, and I see some nods around the room here. And this question is for Joshko. Josh, let me just find the question. So the question is from Malika Sorby. She starts off by saying, brilliant presentation, thank you very much. Joshko, the question is, how long did it take to set up the Emergency Operations Center, and how did you go about setting it up? Thank you, Joshko.
Thank you for the question. The EOC, the Emergency Operations Center for Disability, actually is born out of a conversation. We got to realize that there was a need to inform persons with disability on the ground. And this is started last year from PCSRI. Because it was coming through and the path it was coming through was between VT-level and vulnerable regionally. So, you know, there was a lot of conversation in terms of, okay, the people that will be hit are close to us. So maybe we can get to them fast. And the conversation then started for us to then set up a communication hub. On the evening, we were thankful is that the director and DMO then came up that evening and said, here's my number, here's so you guys can call me directly. And this conversation, you know, led to at least contact details with powers that be. So very informally, it started. And then one time, by the time we got around for the last cyclone period, by the time we got to Herald, it had become a norm. And for TC Nyasa late last year, before the cyclone period came in, people started asking, will we have our, you know, EOC set up? Well, we had that during both YASA, which assist a lot of our members. We started also set sit traps that made to national sit traps. And just as of last week, we had a week-long session with other members and with other branches of the disability sector. There was 11 branches together with the affiliate organizations, and blind person, physicians were there, certificate survivors, physically disabled groups federation, and spine injury came together to formalize. So we're hoping that by the time we get to the next cyclone period, we'll have a standard operating procedure in place as far as the do's and don'ts, because over the last 12 months, it was trial and error. We can sometimes we told, okay, these are the type of information that should be make it. We're also thankful to our partners, even the Disability Forum in terms of the Peru team supporting us on the do's and don'ts. We had our online ministry who came up, that the social protection program is under the cluster. They came and said, no, Joshua, these are some information that should not go into your reports as far as the CTRA. Please go through this other stream. So, we learned, we got to realize that there was a gap. And we said, okay, let's just put our foot into the door. And then, we can always correct it as we go, which often happens with a lot of things when it comes to disabilities, that sometimes we got to push our way through in order to get recognized. Sometimes sitting on the sideline does not really fare well. So often when we come in, then people get to realize that how important or how well it's about and how it's supporting the system is, because then scopings are then done thereafter in terms of the immediate damage assessments. So these are some of the aspects when we look at the EOC, how it was set up. So in a nutshell, started very informally because we just sat down and realized there's a gap. Awareness programs that we've been doing on trying to get something visible was taking a bit too long. So it was, let's try it. We started setting up. We're very thankful now that we're starting to formalize And we're thankful to also the powers that be, to decision makers also, is that they get to realize, okay, it's a useful tool. And it's supporting the system in terms of the way we're trying to get to nationally. Thank you.
Not for sharing that story, Joshko. And again, it really struck me. And it's about having these conversations, having these informal conversations, developing these relationships, and then asking the question. You never know what comes out of asking the question. Can you do this? Can you do that? And out of these sorts of informal discussions, something fantastic can come out of, just as you shared with us. So I see that we've now hit a few minutes after 2, and we now come to the close of this webinar. Before I thank everyone and close the session, I just wanted to just remind us all, I'm sure many of you are regular listeners or participants with this webinar, but I wanted to remind you that this happens every month, last Tuesday of each month. And for those that have not been part of previous webinars, you can go to the Pacific Resilience Partnership Network website, resilientpacific.org, to listen to the past 6 webinars. But next month, again, last Tuesday of the month will be the next webinar. So it just leaves me to thank, say, big Navalev to all of you who have continued to be with us throughout this this webinar. I see that the numbers have remained very consistent throughout. I wanted to thank all our speakers, Nolene, Joshko, Mumia, and also Emily. And Emily apologized for that that connectivity issue at the very end. I want to thank also the organizers of the webinar series, and just wish you well for your continuing ongoing dialogue. So with those thanks, it's time for me to sign off. Thank you very much, and we'll see you again next month. Nava Levu.